Hi, and welcome to the Share Today show. I am your host, Sansaria Baldwin. Are you someone watching, contemplating on sending your parent to an adult foster care, assisted living, or even a nursing home? Well, it may not be such a bad idea after all. You don't want to miss this show. We'll be right back. Welcome back to the Share Today show. If you've just tuned in, we're talking about adult parents in transition with our guest, Carrie. Welcome back again, Carrie. Before we took the break, we wanted to find out when should a sibling or family member, what signs should they look for to know when it's time to make that transition and that decision for their parent, and also what type of facility that they should actually go to.
Certainly. Well, oftentimes, by the time someone is choosing a nursing center or an assisted living, there is a need present. Typically, an event will have occurred that kind of gives you a better understanding of what's happening at home that you're missing.
Let's give an example real quick of an event.
Is mom might have a fall. Mm-hmm. Or another one may be that someone wanders away from the home. Mm-hmm. These are definitely events that can be life-changing. If someone has a fall and a fracture and is unable to get to a phone or a call for emergency help, the question is who's going to do that on their behalf? Mm-hmm. Who's going to be there to make sure that someone is remaining safe in their environment? Mm-hmm. These are general events that will bring people to us seeking to learn more about assisted living options mm-hmm. or skilled nursing centers. Skilled nursing center, again, is more of a type of setting that is very clinically based. So if someone has complex medical needs, the nursing center is definitely going to be a right option for them.
So let me ask you, if someone is falling, okay, would that be clinical or assisted? Because if you're falling, you know what I'm saying? How can we determine the different facilities that they should go to if mom or dad is falling on a consistent basis?
Certainly. The falls in itself is actually more of a symptom of what's happening. Mm-hmm. What is causing it? Is there maybe an infection? Is there an actual debility with the functioning of the legs? Mm-hmm. So usually I would recommend to visit your physician. Have a workup done. Mm-hmm. Have a physician, review the situation. They'll also offer recommendations as well. Mm-hmm. Assisted livings can offer assistance with that, mm-hmm. Meaning that falls can be prevented. We can put things in place so that we're offering more frequent checks on someone. We're offering different types of equipment through home health care agencies and home health equipment to really stabilize someone. So oftentimes there's a fear and it offers them at a whim's notice.
Well, you mentioned one of the signs of maybe the parent leaving the home. Mm-hmm. A lot of times those signs are derived or is a direct result of what we call Alzheimer's. And if in fact a parent is dealing with Alzheimer's, then would that be clinical or assisted living, or do you guys provide services for Alzheimer's?
Absolutely. I think assisted livings actually provide memory care for Alzheimer's or dementia residents much better than the nursing centers do. Mm-hmm. Oftentimes they do better in settings where they have more choice, more opportunity, places that have the things around them that they can rummage through, wander around, mm-hmm. offer a secure environment. Nursing centers oftentimes, again, are very clinical, empty hallways that aren't as user-friendly mm-hmm. for someone who's confused and just wants to look around a little bit.
Also, I want to touch back on the subject in our first segment for those that just tuned in. We talked about guilt and how one might feel guilty about sending their family member or making the decision to send their family member to an assisted living or even a nursing home. How do one deal with the guilt on the parent side that, hey, my daughter and my son, and they don't have dementia or Alzheimer's. They're very, they're very skillful up here. They can think very well. But now they're having a guilt trip on, why did they bring me here? Why did they do that? How do you deal with that?
Well, oftentimes we, again, try to get the physicians involved. And if you kind of spread the blame out amongst different people, your doctor has recommended this, we've tried what we could at home, and most families have exhausted other options, and things just aren't working out well, where they will need 24-hour care and supervision.
Well, we understand that, but how would the sibling that's making this decision on the behalf of the parent convey that information to their parent, where the parent doesn't become guilty or emotionally affected because of the decision that their children have made for them?
Well, it is very difficult because all family dynamics are different. We just try to guide, again, families to share that information of your doctor's making this recommendation. This is going to offer you more opportunity to have socialization and build relationships and friendships, companionship. And try just to find the good points, find the elements of assisted living that they really cherish. Now, Mom, you don't have to do your cooking and cleaning. Now someone's going to offer you dining services. You're going to a restaurant each day. You have options on your meals. You're going to have your laundry done for you. You're going to be able to enjoy your time.
And then also, I'm sorry to interrupt you, but I think they should come to the facility that they're choosing to take them to and get them comfortable. Thank you, Carrie. We got to go. Listen, I appreciate your time for being on the show. Up next, we're going to be talking to someone. I can tell you one thing. You sold Sunrise. You sold Sunrise on the show today, that's for sure. Up next, we're going to be talking to Ms. Schoner, who actually have had the experience of making this decision for an adult parent transition. Thank you for being on the show. We'll be right back.
For more information, contact Share It Today at 8.
You should be watching Share It Today with me, your host, Sansaria Baldwin. Share It Today is a show that provides information, education, and entertainment. Yes, it's a diverse show. It's also a show that care enough to share. I'm a strong believer the more people know, the more that they can grow. You should tune in.
Watch Share It Today on Comcast in Southeast Michigan, Saturdays at 9 a.m. and Sundays at 8:30 p.m. For more information, contact Share It Today at 877-892-2731 or visit shareitnumber2day.com. Share It Today is another source of outreach for the mission of Virtuous Family Community Services, helping build families for opportunities and advantages. Visit us online at www.vfcs.org or email us at help@vfcs.org. DVDs are available for purchase online at shareitnumber2day.com.